I'm Ali Amarachinene, a bachelor degree holder in nursing sciences, a medical volunteer, a registered midwife, a registered public health nurse. Our menstrual hygiene day was on 7th of June 2019, during which our team of medical professionals went to 3 communities. We went there, and when we went there, we seized the opportunity to health educate them on different aspects of their health. We actually captioned it menstrual hygiene to attract them, because when we went there, we taught them sex education, we health educated them on personal hygiene and on the need to be focused in life amidst distractions. After which we afforded them the opportunity to ask us questions as regards their health, and then we shared the parts we went with. They expressed their appreciation and hoped to see us subsequently. Currently, we are planning 2 health programs, one of which is a community eye medical outreach, during which our team of health professionals plan to storm our communities and health educate them on some of these eye diseases like glaucoma, cataract, conjunctivitis, and river blindness. We all know that most of these diseases are endemic in rural areas, owing to reasons like ignorance, unhealthy lifestyles, poor socioeconomic status, and some superstitious belief. So we hope to correct this, we hope to proffer solutions to this when we get there from the medical aspect of it. Secondly, we want to create an awareness on sickle cell disease, during which we plan to teach the marriageable youths, people in the community, particularly the marriageable youths, on how best to prevent sickle cell disease. It's quite surprising actually that in our time people still attribute sickle cell disease to something spiritual, and it's not. Then for the parents who have wards that are already suffering from this disease, we plan telling them how to take care of these ones. It's not their fault. The mistake has been made. It's needless crying over it. But the truth remains that we plan to help them know that something could be done to help these ones survive, especially as it relates to the medical, emotional, and psychological aspect of it. Currently, we have a mentee who is a sickler. She's a girl, and as a result of her status, she has been deprived of her right to education as a child. She has been deprived of the care, the affection that should come from the very people that should shield her from public abuse and stigmatization. These are exactly the people tormenting her, if I should say so. They're making it look like it's her fault to be a sickler, whereas she has done nothing to contribute to it. Now she's suffering it. But thank God for KYI Health. We are doing something about that and hope and pray to ameliorate the situation. I've been with KYI Health initiative for a while, and I'm appreciating the fact that KYI Health initiative has exposed me to some realities obtainable in the rural areas. Before I met them, I could only I could only imagine some of these realities. I even doubted some. But when I started with KYI initiative, I saw that they were actually real. Some of these stories of the girl child not being allowed to go to school just simply because of her gender. Some of this story of a sickler not going to school by reason of the fact that she might end up amounting to nothing. It's possible she will die along the way, you know. Some of these stories, in our time, I never believed they were real until I came in contact with KYI Health. And it afforded me the opportunity to put in my little best, especially as a medical professional and as a teacher. Actually, I've come across some people by reason of being a member of KYI, that is KYI Health initiative. Particularly, I want to talk about this person. His name is James Mwasum. When I joined KYI, I heard his story, and I was surprised at his level of apathy towards his destiny. He wasn't really interested in education. We said, okay, let's. We also heard the story that even while he was sent to go and acquire a skill, since he wasn't interested in education, he treated it with levity, and we've been surprised why this had to be so. But just within a short while, his stay in KYI Young initiative, a lot of changes. I ended up seeing a lot of changes in him. Currently, he's under our skill acquisition program. He's one of the 3 that have gone to Enugu to acquire a skill on graphics design, and I think it's a drastic change, which I believe God was able to make happen through KYI Young initiative. My advice to people out there, especially the young ones, KYI Young initiative provides a whole lot of opportunities. And the stunning aspect of it is that KYI Young as an initiative has people who are dedicated and sacrificial in nature. These people have forfeited a lot, and they are even ready to sacrifice more resources at their disposal, just to ensure that young minds are built and reconciled to purpose. So I am pleading with every youth out there, every young person out there, to harness these opportunities for a better tomorrow.